Hi, my name's Crispin Hiley. I'm one of the clinical oncologists and a clinical academic here at UCL. I treat lung cancer. We use standard photon-based radiotherapy to treat patients. Protons, another type of particle, we're building a new proton center here, and protons offer the potential to decrease side effects for patients treated with lung cancer, but also allow us to increase the dose and hopefully increase outcomes and improve outcomes for patients. However, there's two main technical challenges using protons. Firstly, because of the nature of the particle, the dose is deposited over in a much smaller area compared to photons, which means that modelling that dose deposition results in some uncertainties in patients. Combined with that, lung cancers also move. As patients breathe, they go up and they go down. So knowing precisely where that tumour is at any one moment is crucially important. And this project hopes to combine both imaging with protons and delivery of radiation with protons to try and improve outcomes for patients. We hope that the results of this project will be incorporated into clinical trial protocols and make a real difference for patients. And now I hand over to my colleague Charles to talk about some of the technical aspects.
So hello, my name is Charles Antoine Collins. I'm the technical engineer part of the project that has been just described recently by Crispin. So to address the technical challenge that Crispin has outlined before, what we are proposing to do is to accelerate the particle beam, the proton beam, to a higher velocity so they have more range and cross the whole patient, therefore producing an image at the exit. This image will at first come out blurred because of the Coulomb scattering that particles will suffer whilst they cross the patient. So the first part of this project will be to develop some algorithms to reduce this blurriness and improve the image quality. Then, when the image is acquired, we will move on to some simulations of treatment where we can define an imaging protocol that will tell us when to image and how to use those images to improve the treatment quality, to reduce those range of uncertainty and to account for the motion of the lung cancer. This will first come in simulation part and will then be done into the experimental setup on anthropomorphic or human-like phantoms, which will reproduce a patient with lung cancer. Finally, if the project's going well, we might be able to move towards developing some clinical trials and protocols.
Hello, I'm Gary Roll. I'm Head of Research in Proton and Radiotherapy here at UCL. We have a large multidisciplinary research team covering a whole range of topics, engineering, physics, biology, oncology, radiology, and we have a very close collaboration between the academic side and the various departments here, and on the clinical side with the cancer division. We are in a unique position here at UCL in that we have all the facilities that we'd need to carry out this particular type of research. We have a proton center. Our first patient is in a couple of years, but before that, we will have access to the beam and all the technical facilities needed, so we can be up and running very quickly. So be pleased if you select our project and join our team of talented engineers and clinicians and help take our walk forward and improving the quality of life of cancer patients.